Now all I remember is mountain biking is a terrible idea, and you should you can't really have fun in life anymore.
Hi everyone, welcome back to Wired for Hope. I'm Dr. Jess, a clinical psychologist, university lecturer, and published author. On Wired for Hope, we talk about all things brain injury, cognition, and mental health. If you like this episode, you can like and subscribe, and you can also follow me on Instagram at Dr. Jess Neuropsych or at Wired for Hope podcast. Without further ado, please enjoy the episode today. I wanted to start by asking you a simple question, although perhaps it's not that simple, is how do you identify what kind of words come to your mind when you think about who you are, and how would you describe yourself to another person?
It's kind of funny or awkward because the other day I applied for a grant or something and they asked what nationality I identify as, and I wrote cosmopolitan, which is maybe not very relatable to a lot of people. But I'm from Hong Kong originally and came to the UK for my A-levels. But, we can do the story route, but also just identity-wise, I like sport. That's one of the things that is enjoyable. I don't always find it meaningful, but it's very fun. I like helping people. I try to use my time, my career, if you can call it that, to do meaningful things. And I think that's where I find meaning. I mean, it's not necessarily a great place for identity, but it is what I find meaningful.
Helping people through your career and through your experience.
Or even just time, life.
Through time, life. Yeah. So the kind of words that come to your mind are sort of thinking about, where you're from geographically on this planet, the sports you play and what you do. And then also thinking about, how to be helpful to other people. Yeah. And the reason I'm really curious about this question, and perhaps we'll get into it more as we talk, is because I'm really interested in the way that people think about themselves and think about their own identity pre and post brain injury. Because for many people that I work with, a brain injury might materially impact the way that they parent, for example, and being a parent was a core part of their identity or the story that they might share with other people about who they are. And so I'm really curious for you about, your journey as a sports person. And
not a successful one by any means, but yes.
And how brain injury has kind of impacted on your identity.
Yeah, absolutely. Absolutely.
So maybe you could start by telling us a little bit about the sports you play and also the circumstance of your brain injury.
It's a long list. I think in first year of uni, I tried most clubs other than something like golf or something.
Much to my partner's dismay.
I mean, I play mostly ultimate frisbee. I also mountain bike. I snowboard. I play badminton. I play anything that moves. Racket sports are fun. I suck at tennis. But I do like the adrenaline side of things. I took up actually snowboarding in first year of uni or second year, something like that. Did a black slope on my third day.
Oh my gosh.
Probably also hit myself a bit too much during that time, but anyway, that's the type of thing.
Mild head injury.
Yeah.
Okay.
Not that I have any sense of that back then. But I actually started mountain biking when I came to the UK. But yeah, like sports and I mean, talking about head injuries, even just thinking back to being a kid, my parents brought me to school open day or something, and within I don't know, 30 seconds, I was running around with the other kids.
Mm.
And then the other parents asked my parents, do they know each other from somewhere? And then they're just like, no, like this is just Aaron. So I
What do
think
you attribute that to?
I've recently got diagnosed with ADHD, so you can call it that. I think it's just, yeah, I really like bonding with people, or that's the main method that I find easy to bond with people is to play. And it's fun. You know the rules, and you get to move, and sometimes win.
Yeah.
A bit too competitive, but yeah.
And where does the adrenaline, interest in adrenaline come from? What's that about, do you think?
Yeah, that's interesting because I bet at some point, like there was also like I thought it was cool.
Of
You know,
course.
you watch whatever Red Bull or whatever thing, and highly discourage certain like sort of risky activities, but you find it cool. But also, I think for mountain biking there was a certain flow state that I would feel like it's almost meditative. Like it's not a podcast about mountain biking, but you're sort of like in this balance between it's dangerous enough that it's difficult, and it's such that like there's this graph where basically there's like the risk that you're taking, and then there's the fun, and like you want to be exactly on the like sort of fine line where it's like difficult enough to be fun, but it's not boring or it's not you're gonna die. And within that moment, you're going sort of up and down the hills and you're just enjoying yourself, and you can't really think of anything else in life because you've got to concentrate on that one thing.
Gotcha.
And so you kind of forget about the rest of things to worry about. And obviously, there's that in ultimate frisbee as well, and just having a good fun winning or making a point with friends, and teamwork, and that's also fun, working towards a common goal. And yeah.
I really want to ask you about flow state and ADHD.
Yeah.
But first we'll talk about the circumstance of your injury just so that listeners are aware, and then we
Yes.
can get into that.
Yeah.
Yeah. So what happened with your injury?
So this was after COVID, and you know, there were, I don't know, 3 lockdowns or something, and it was one of the first times I was back out, just having fun with friends. It was our first sort of not more than a day trip, multi-day trip, and we were in the Lake District, and I was very keen to get us mountain biking. We got on the trails, and still remember this friend being a bit slow because the other two have mountain bike with me before, and then he was a bit less risk taking, and being patient with him. But to be honest, I don't know what happened, because all I can tell you is that's sort of my last memory. So I bet that I was a bit impatient with him, and then once I got the chance to sort of go for it, then I must have, well, hopefully had a bit of a time of my life, but then ended up with a crash. And I have some pictures of this time after they found me. I don't think I lost consciousness, but I can't remember anything from the incident. I was wearing a helmet. I got hit sort of somewhere here in the face.
So kind of in the middle of your face, sort of near your mouth and nose.
Yeah. And my friends sort of funnily enough finished the trails, and because I was still you know, walking and talking, and the guy sort of, they called out the guy from the shop, who came out with a van and who first gave me first aid, and but then finally my friends did come and pick me up to bring me to the hospital. Yeah, anyway, so we got to the hospital, still very blurry. Apparently I was on the ride there, talking gibberish, or just kept asking, you know, where we're going, what's happening. I think I hit my head, which is kind of funny. and
So you were responsive in a way, but it was
yeah,
a bit disoriented, a bit confused. You lost a bit of memory from the actual incident itself. So there's a bit of kind of post-traumatic amnesia just around that
exactly.
time. And you were moving your body, but yeah, you were in a little bit of an altered state of consciousness, it sounds like.
Yeah, definitely.
The reason that I'm just going through that is because I'm thinking of the Glasgow Coma Scale.
Yeah.
Do you know that
Yeah.
one? So if you have a higher score, you're more kind of alert and with it, but you probably wouldn't be scoring maximum points because you're a bit disoriented
Yeah.
and confused. Yeah.
Absolutely.
Okay.
Absolutely. And so the basically they gave me a CT scan and which came up clear. And this is the bit where I started remembering things. I remember writing down my address and whatever and being a bit slow at it. Feeling a bit drunk probably. And but effectively, it's not going to be verbatim, but effectively what they said is it's just a concussion. And they gave me this sort of head injury leaflet and, sent me off.
Yeah.
And that basically says if you vomit twice, come back. If you have seizures, come back. Otherwise, that's pretty much all we can do. So, went back to my friend's home and initially I was still worried about, it's my face, visually or whatever. And actually in the first few days, it didn't necessarily feel like anything was like, it wasn't obvious that I was gonna feel terrible for forever. But then it's when I got back to London that when I started trying to go back to uni where I was doing my PhD, that I really seriously struggled with concentration. So every time I tried to concentrate, I would get a massive headache. I also struggled with noise sensitivity, motion sensitivity. So like going on tube was hell. We switched to Lena and I, like for our dates or something, we switched to trying to go on a bus. Then found out that even without the noise, it wasn't great. I tried meeting friends in cafes, and then the coffee machine was too loud.
And can I ask you, when you had those experiences on the bus and in the cafe, what were you experiencing emotionally? Do you remember what was going on emotionally or in your body?
I guess like it's a bit like, and I've told you this before off the podcast that I'm not great with naming emotions, but I think the way that I would identify it is if I would be like screaming inside, like why does my life suck so much? And why, and why me, and I was silly, wasn't I? Like doing mountain biking, and
thoughts were running through your mind.
And I would joke that also that like, hey, if I'm gonna crash, at least let me remember it so I know how not to crash next time.
Okay.
But I don't remember
it. A bit of a post-event analysis. Kind of wish you had some memory of that event, so you might prevent some future. Yeah.
So now all I remember is mountain biking is a terrible idea, and you can't really have fun in life anymore.
Wow. Yeah.
Maybe, I mean, speaking of brings back emotions, maybe I didn't always fully analyze it to that degree, but like that's sometimes how it can feel, even when I got better, that I like it sort of ruins everything, like because as I mentioned, like fun for me in life is things that are slightly risky sometimes.
Mm.
I'm not trying to get injured, but also I get very bored very quickly. So it's just like the whole world also became more boring, and that's just the sort of fun side of life.
Yeah. Yeah. Tell me about the impact that it had on your social world. So I can imagine your hobbies, for example,
Yeah.
um, not mountain biking for that period of time.
Yeah, not only not mountain biking. So I cycle everywhere in London. And just being advised not to cycle, to walk everywhere. Well, the advice is just not to cycle, but I can't take the tube or take the bus, so
Because of the noise sensitivity.
and the motion sensitivity, and so you're just left with walking.
And how did that constellation of difficulties impact on your social life and
Yeah.
your relationships?
Yeah. It's funny because I mentioned the coffee grinder, or the coffee shop. To be honest, I don't think I saw many friends. Maybe the cafe was the ones that I tried. But I think my social circle really decreased. Even the friends that I had the accident with, I'm not sure they necessarily got it at the time, or that I had the headspace to try to explain to them how much life is sucking right now.
Yeah.
And it was pretty much go to Imperial, go to uni, try to work, fail, walk home, try to sleep, terrible sleep, wake up, and maybe a few dates with Lena in between. And those also sucking.
Yeah. So your life changed quite dramatically.
Absolutely.
And what I always find really interesting working with people who've had a concussion, it's interesting, you note the phrase, it was, in air quotes, sort of just a concussion, or that's how it was sort of described to you upon leaving. But as we've discussed before, there's this small segment of the population who has these longer lasting symptoms, and you are one of them. And I guess I'm always struck by how invisible some of these difficulties might seem.
Yeah.
Because you're up walking around, talking, doing your PhD, but actually there are some significant or subtle shifts in things like executive functioning or concentration or head pain and things like that. So how did your community come to understand what concussion is, or what head injury is, or indeed maybe the longer term consequences of head injury?
I think this is what's difficult, actually, and so little jump forward, because of what I'm doing right now. The stat that you gave, actually, the stats around how many people have long-term symptoms are quite varied. And I actually recently saw that 82% of people still have at least one symptom up to
Following
12 months.
Wow.
And maybe it's like similar percentages for 3 or more symptoms with half a year. And so, but that's not what you hear, I think. That's not what you and so to answer your question, it's kind of sad, but I just have to, like, it's just the truth to say it, that I don't think that my community and those around me actually got it, or even get it right now, and I haven't necessarily tried to explain to them in depth that, because it's sort of this thing that's happened a few years back now, and unless the conversation comes to exactly that, then we don't really talk about it. So I mean, Imperial gave me a lot of I was going to say the word support, but it was more like they were understanding of giving me more space to try to recover, but it was more like a you do whatever it takes type of thing, and we don't know what to do.
Gotcha.
And yeah, I think the lack of understanding within both patient groups and clinicians is just sky high.
Yeah. So tell me about what did make a material difference for you, and if you have any symptoms currently.
Yeah. So I was struggling so hard. I Googled back then. And saw something, and it said you must find a concussion specialist. And so I found a specialist online. He sort of assessed me um, uh, in person, and for different dysfunctions in my brain. So there's your sort of blood circulation, which can trigger symptoms if you're going out for a walk or something, and your heart rate doesn't match, then you don't have enough oxygen in your brain. So obviously you have a bunch of problems there. There's symptoms from your neck, from your balance system, etc., etc. And so he gave me rehab for each of those based on the test results. And sort of slowly seeing him week in, week out, then I actually, have the tools then to do something, and to see the progress, and to try to get better.
And what, if anything, was helping with the noise sensitivity and the sensory stuff, sequelae?
That's very interesting. So, nothing like as a specific, like there wasn't like, oh, this YouTube video you need to watch to get used to it. I think
people can't listen to this podcast and know exactly what to
I'll just
do.
do some, I don't know, anyway. But I think that probably comes, and I don't know the science behind this exactly, but it probably just comes from the aerobic exercise, and the general, your brain's capacity, cognitive capacity, returning back to normal. And it's the same for sort of the head, the concentration problems, like insomnia, all of those automatic things that normal people take for granted, as you should, really.
So am I right in hearing that for you, the recovery was based around kind of these physiological interventions, as opposed to, for example, psychological interventions like CBT?
Absolutely. I mean, you can argue whether, seeing the concussion specialist, having somebody who understands, that probably helped a bit as well.
To normalize or
to understand that other people, exactly. I forgot to say there's also one part which is to try to not what he calls yo-yoing, basically, like not to try to do a lot in one day and then, oh, I have terrible symptoms now. Tomorrow I'm going to do nothing. So it's trying to return slowly, and not to sort of sit in a dark room for 30 days and then try to go back to work once the symptoms go away, type of thing. Because the moment you do go to work, then everything comes back. But I was terrible at that, because I was quite desperate to. I'm not saying that my PhD supervisor by any means forced me to, but I was quite desperate to show that I can still do my PhD. Don't fire me. Like all of those things that come into your mind.
So much pressure.
Yeah.
So I guess I'm just thinking. There's two things I want to say. That the first is that graded return. Often in health psychology, we talk about boom and bust. So that's a really kind of like common intervention or discussion that we'll have with anyone returning to work following some sort of health event, is avoiding this overexertion, and then followed by this deep sort of recovery period, for example with chronic fatigue and things like that. So similar kind of thing with head injury. But I'm also really curious about the kind of work that you specifically had to do as a PhD candidate, which relies so much on your executive functioning, your ability to concentrate, to plan and set goals and then follow through on those things, to persist for long periods of time, kind of reading or, writing, for example. And then crucially, being able to synthesize information, which requires you to hold lots of different ideas in mind at once. So one thing I'm really curious to ask you is about how you as an academic found coping with a head injury, and how this kind of impacted on your identity as an academic, or on your sense of self and your well-being, your confidence, things like
Yeah,
that.
yeah. It's just interesting because I think there are two strands to that. There's the academic side. There's like the can I do this, or can I like career side of things, and then there's the like sort of we touched on at the start what drives me and what is meaningful for me is to help people, and if your identity is tied at least a bit to productivity, even good productivity, then that has a massive, not being able to be productive has a massive impact on you. And yeah, that definitely was the case for me. And but at the same time, when you're in the middle of it, you sort of are just so stuck. You might know, and even after I met a concussion specialist, he's telling me, oh, you need to gradually build it up. You can't go to 5 hours tomorrow. But you just sort of struggle to see that, and also you struggle to sense any progress. And yeah, it really impacts you. Yeah.
And how did you work through that psychological process? Did you seek professional help? Did you rely on friends and families? Did you dive into the research? How did you move through this period of time?
Yeah. Those are all things that I think I would have done and should have done if I was healthy. I think normal Aaron would have done that. But then it's kind of, you're just in this weird headspace where you just can't have enough executive function, as you say, to make good decisions. And really, I think I recovered mainly through the physiological means. I didn't seek. I would have benefited from somebody to process the sort of more psychological side of things. But in this instance, I got better, and I mean, in some sense, it's a chicken and egg scenario, right? If you can solve the actual reason people are depressed, which is that everything sucks in life, and it happens to be curable, then
your headaches and the noise sensitivity.
Exactly. Then that's sort of a bit more of the root cause for me.
Yeah, for sure.
And so, but if you can't, then obviously I think it's so important if actually it's permanent, that you really, really can't do what you were doing. And I mean, let's be honest, like at least a third of our lifetime is spent on work, probably more if you don't count sleep. And so it would have an impact on anybody, because it just changes everything. And it's actually not just the work, it's your fun, it's your
absolutely
social, it's, I don't know what else to count. There is not much else to count in life, I think.
The constellation of things that make us human and give us meaning and joy, our social world, our hobbies, our vocation. It has a huge impact. And how long did it take you to become symptom free?
So I think this is quite hard to define. But I would say maybe 2-3 months, with maybe like one or two things where I'm like I'm not sure if, because I've now know what a very intense headache looks like. I can feel the tingle when it starts. And I did, before the head injury as well, have some sometimes have had headaches. So I don't know if I just were more sensitive to it happening or not. But essentially that, although I do have to say that one of the main problems was remembering names. Something went weird in my brain in that part. And I won't say who, but there's this person a friend who I went to the wedding of, and I actually just couldn't remember their name after the head injury, and I just struggled so much. And it wasn't like I worked it out at some point, but then I would see them again, and then like it would just blank, like, and I needed to sort of somehow retrain that. And also I struggled a lot more with remembering names when meeting people. But
and now, how are you now?
Now I think I'm within the sort of statistical norm, maybe still on the bad end, but yeah.
Within the norm. Okay.
Yeah.
Gotcha. So it was sort of a few months of working with this concussion specialist, doing some kind of physiotherapy type rehab exercises that you started to notice an improvement.
Yeah. I mean, probably actively working with him maybe like 2-3 months.
Okay. Cool. And now you have co-founded this company.
Yes.
Called Heady.
Yes.
About recovering from head injury.
Yes.
So do you want to tell me a little bit about that?
Yeah. So I've been leaving this out, but actually, the concussion specialist, his name is Dr. Theophali. He sees Olympic athletes and treats them for concussions, and I one day, while he was treating me with manual therapy on my neck, then I said to him, actually, what you're doing, well, it's very expensive. I was lucky to have had private insurance from Hong Kong, because my parents happened to have that. And I said to him, we could actually digitize this. Like, we could bring this to more people, and it doesn't need to be only available outside of the NHS to a few people, basically. Yeah. And so we started working on packaging everything into an app, and this is not just like it's not a video call and then Theo pops up. It's actually we put all of the assessments and all of the rehabilitation exercises in there. You self-guide yourself with the app to test yourself, and then get inserted into our dynamic rehab pathway. And we also analyze your activity, your symptoms, sleep, different things, to figure out, cool, so this is how you feel today, this is how you felt before, this is what you've done, how much activities should you actually do? So all of the sort of, and it might be me with my ADHD brain, but I really struggled with all the good advice that Theo was telling me. What I needed somebody to tell me, 5 seconds before, not like 5 days before, what to do.
Yeah.
And so it's trying to do that, bringing in all the behavioral science, and making everything very, very frictionless. Yeah.
I love that. Yeah. So it's widening access for people who wouldn't, typically be getting that. Because I'm thinking about the services that I've worked in, and it's very rare that we see someone with post-concussion symptoms or long-term sort of complications from a concussion. Typically the services that I work in or other clinicians work in are where there's been a moderate to severe head injury. But we know that people who have had concussions have these long-term symptoms.
Absolutely.
And typically we treat that, well, as a psychologist, we treat it psychologically.
Yeah.
So we start to think about, sleeping patterns and stress and managing stress and boom and bust cycles and
Yep.
things like that. But I haven't come across, someone who can kind of help with some of the, exercises you're describing. I suppose when I've worked with doctors and physiotherapists in the past, the consequences of their head injury have sometimes been so severe that people are struggling with mobility, for example, or getting out of bed and things like that.
Yeah.
So it's really interesting to hear what is available for people who are, returning to work and thinking about also trying to manage these symptoms.
Absolutely. Absolutely.
Yeah.
I think it's kind of weird because you think about the sort of 1.4 million people going to an A&E, like myself, 80% of them will be classified as a quote unquote mild traumatic brain injury.
Yes.
And I both love and hate that term because it makes a lot of sense. I'm not dying. Don't treat me the same way as the others. Please prioritize them. But the research actually shows that regardless, other than the sort of more severe, like really, really severe permanent disabilities, if you're sort of saved from that life and death situation, your long-term outcomes are very, very similar. The sort of label has nothing to do with your long-term symptoms. And so that's 80% of everybody is classified as mild, but then most of them will go on to struggle for at least a year. And the stats are something like, I don't know, like 1 in 4 will have a suicide ideation in the first year, type of thing.
Yeah, absolutely.
But you wonder why, and we talked about this, and everything sucks in life.
Your life completely changes.
Yeah, absolutely. So we're trying to help that, starting with hopefully easier to treat side of the spectrum.
That's amazing. And you and I and Thea will get together and do a whole podcast episode on the app and how people can find it and what kind of things will be on there, and maybe a little bit about the evidence base behind some of those treatments so that listeners can have a better understanding of what that is.
Amazing. I can push it on. I'm joking.
But one thing that I want to come back to that we've touched on a couple of times, I'm thinking about a lot of people that I work with who have ADHD or neurodivergent use exercise to manage the kind of ADHD, and I'm just really curious actually for you, how did you sort of manage everything that was going on inside without being able to exercise or express yourself in that way?
The honest answer is I didn't manage very well.
Yeah.
I mean, you can say it. Luckily enough, one of the exercises is to actually do aerobic exercise. So I would go on my stationary bike and do my 20 minutes. That's allotted from what the concussion specialist told me. But I was never a jogger or like a swimmer or anything like that, and I hate boring sports. So like it's actually a bit different. Like I want the fun, I want all of that. So it really was more the root cause needing to be resolved in order for me to have fun.
Yes. And for those of you maybe who have video content watching this, Aaron's come in with his skateboard and also an airbag.
Yes.
So can you tell me a little bit about what you do now to practice safer sport? And how do you sort of look after yourself from a head injury perspective? What's going on with this airbag?
Absolutely. So I went into a deep dive after the head injury, and I bought an expensive snow sports helmet, a full face one, so that if anything happens to my face again, at least there'll be a bit of a a shock absorber. But also I did a lot of research. I'm a mechanical engineer by background, so airbags just make a lot of sense in terms of there being for this particular one, then there being 8 times more sort of time for the absorption of the impact, and hence the force is 8 times less, which means that the acceleration is 8 times less, pretty much. And the acceleration, or rather the deceleration, is actually what makes your brain shake and then cause all the shearing and all of the problems to come out.
You wear this around your waist as you cycle?
No, sorry, around my neck.
Around your neck. Ah, so you've got your helmet on and then you wear this airbag around your neck.
Yes.
And then
no,
collision.
It's no helmet.
No helmet.
So this replaces the helmet. And I mean, it's not an ad for them because they're dead anyway. But you can activate it, and if I sort of go for a very serious deceleration or something, then it detects it and then it goes.
And once it's activated, is it game? Is this done now? Or
it is, and it's expensive as well. But it's much more expensive to see a concussion specialist or die.
Yes, I was gonna say, can we try it now? But I won't. No, we don't have the money for that on this podcast at this stage.
Yeah.
Okay, cool. Is there anything else that you would recommend that people are doing when engaging in sort of more risky sports? What are your thoughts on that?
Is to not trust your PP, your protective equipment, too much, I think, as well. You're not, because there's this overcompensation as well that people make when they have better and better equipment, that they go wilder. So it's kind of a healthy thing to remember. It might not go off, so don't go crazy. Buy the best gear, but at the end of the day, I mean, as much ADHD as you have, and try your best to stay safe. Yeah, but at the same time, it's kind of a weird balance. We talked a bit about cycling before the podcast, and exercise, sport. It's all good. I think the stats are working out that yes, you might cycling in London, you might get into an accident, but overall your health gains from exercise is just so much better that you will live longer on a statistical basis, or you might die young, but statistically you're going to live longer.
Yeah, if you exercise. Yeah. And what are you back to now in terms of exercise?
I still am more on the hesitant side around mountain biking. I hope that would go away to a healthy extent so that I can feel like I'm not entirely banned from doing that. I play a bit more badminton because it's just
that's low risk of head injury.
That's very low risk. Yeah, and I can do whatever I want. It's just the psychological part of it. Yeah.
You mean sort of a resistance or worry or
yeah, slight worry. Just also, I guess they say that when you turn 25, that your brain fully develops.
That's right, that prefrontal cortex.
Exactly.
Is
I think
snatched at 25.
and I had my accident before that, and I was just like, now I'm a bit more like, maybe not worth it.
A bit more wary.
A bit more wary, yeah.
Aware of the consequences. Well, that makes so much sense, doesn't it? Not just being past 25 in your prefrontal cortex, but also your significant life experience.
Exactly.
Yeah. Okay. Well, one question I'd really like to end with is, I was wondering if you had maybe 2 things that you might wish to say to someone who's sort of in the early stages of their recovery from mild head injury, although I know that's a bit of a misnomer in some ways. What might you wish to tell them or say to them?
I think there is hope. Actually, funnily enough, that's one of my last slides when I first tried to start pitching Heady. And especially on the mild side, you can get better, and you can be tested, and you can be actively rehabilitating yourself. and get better. But at the same time, don't rush back into it. You might not sense the progress, but the more you rush, it's only gonna make it worse. And I'll hear that on a podcast and not follow it, but please just do it.
Yeah. So slow and steady.
Slow and steady.
And there's hope. You'll get there from your experience, from your research. Yeah. And in my experience as well. There's a lot of hope.
And actually, I wanted to add something for anybody who has, I guess, feels like they are not understood by those around them, or even by the medical professionals around you, because I've heard horror stories, but literally every single time I speak to a patient, that's what I hear. They go to their GP and the GP says, I don't know, have you tried paracetamol, or come back in 2 weeks, and then they go back again and again, or something like, oh, you hit your head and you have some symptoms. Makes sense. And that can be very, very damaging to the patient. And but really, I would just say that if you can get those around you, especially maybe your loved ones, to do their own research, or just send them. I don't know if this podcast is helpful. If you think it's helpful, send it to them. But basically, because you are drained, it's very hard for you to explain to them what you need. Obviously, do that, but it's more helpful if they can do the research as well, and because for you, cognitive load, physical load, everything is going to drain your battery essentially, and so you could do with some people really loving you and helping you and understanding you.
Great. Thank you so much, Aaron.
Thank you so much for having me here.
Thank you, everyone, for listening to Wired for Hope today. I hope you enjoyed it. If you like this episode, you can like, subscribe, and follow, or follow me on Instagram at Dr. Jess Neuropsych or at Wired for Hope podcast. If you want to hear more about my personal reflections or the context for the interview, head over to where you get your audio-only podcasts, such as on Apple, and I'll share a little bit more about the context for the video and who the speakers are in those episodes. Please note that this is not a substitute for direct psychological advice or support, and you can check out the podcast notes for a list of services in the UK to support you with your mental health or after brain injury. All right, thanks everyone.